I know I said I was coming on at 7, but I'm tired. So I wanted to come on a little bit earlier because I know that after I take my chemo pill, I'm going to be out. I just know it. So I'm debating on if I should do my opening. I wake up in the morning, thank the Most High, husband, 7 kids. Thought I stopped at 5, a roller coaster ride. German Shepherd by my side. Love the holidays, come along for the ride. If you try to copy this and don't give me my props, I'm a train without brakes. Shot it can't be stopped. It's your mouth you dropped. It's the mic I drop. I do it all from an Android, no help, no gigs, no props, no team of yes men, not even a laptop. Let's go. Well, y'all, I said I was going to come on today live at 7 o'clock. And I believe I'm about 30, 35 minutes before 7, but I'm tired, I'm drained, and I got to get up early in the morning to go back to the clinic, to the infusion room, because I am in preparation for a bone marrow transplant. So this is where it all begins, I guess. But I got to get up early in the morning. Let me see who's in the room. Nova, how are you? I gotta drink a swig of water. Hey Nova, I haven't seen you doing a whole lot of lives like you used to. What's going on with that? I hope you're doing good. I hope you're taking good care of yourself, keeping up on your meds, your health. Hello, your mental health, your physical health, mental health most importantly. But yeah, I just wanted to come in really quick to just kind of thumb through what I'm being told to do, my self care for being a patient, inpatient and outpatient, basically getting ready for this bone marrow transplant. And to be quite honest, I'm a little bit nervous. I'm excited and nervous at the same time. I'm going to keep picking the phone up because I can't hardly see y'all. You're going to donate to science? That's nice. That's really nice. You never know. You may save somebody's life by them being able to study something from you. You never know. Okay, let's stay on topic, y'all. Let's stay on topic. Yes, greetings to everybody. Make sure you speak to everybody. Hello, hello. Make sure you speak to everybody in the room. Well, everybody that you can speak to. Try to speak to. If you are a content creator, I have no problem with you saying, hey, I'm a content creator. Check me out. Just don't spam the chat and keep saying it over and over again, okay? Hello, hello. I just came in really quick because I wanted to just share with you guys. If y'all don't mind, click the thumbs up. If you're on your phone, you could just tap your screen 2 times, double tap your screen, and that will give me a like. Thank you. Thank you. Y'all like my new earrings? It depends on what the advice is for. I don't consider myself as a person that could give advice. Oh, I can't give you no advice on that. I'm not a money person. You do like my earrings? Thank you. I thought they were so cute. I can't help but to wear them. Thank you. Let's get started with this self-care portion. Every time you go through something medical, they always leave these little books in your room, and sometimes I usually just throw them in my bag and don't really look through them. I might just thumb through them a little bit, but this time I decided to kind of go through it a little bit more, and I saw some things that was kind of interesting in the let me see, in the part that says self-care. Yeah, I saw some things that were interesting, so I thought I might wanted to share to with y'all. I got them off of Amazon. I got my PJs off of Amazon. I'm a big Amazon girl, and I like to put things in my cart and then wait till they go on sale and then purchase. So yeah, that's what I do. Okay, can we stay on topic? But anyway, first things first. Of course, they tell y'all to wash your hands. They tell the patients and the visitors, keep your hands clean, keep your hands washed. Have no problem with that. Yes, God loves me and God loves you also. And I love God just as much. Yeah, they say wash your nasty hands. So that was a given. It wasn't until I started getting on through it when they started talking about like showering and stuff. I was like, okay. So, first things first, when you're going through chemotherapy, sometimes your skin gets a little dry. I had the issue, and I still have the issue a little bit with my hands, but it's better than it was. It was cracked. I had cracks going along the creases of my hands. And now that that has healed, now I just have basically dry skin, and I have to constantly like slap Vaseline on my hands after I wash my hands. But in the booklet, it was giving you different names of brands that you could use on your hand or your body, whatever moisturizing creams you want to use or lotions after you shower. That was different because I didn't think they would want to advertise a certain brand. Yes, that's what leukemia is. Leukemia is a blood cancer. Yes, I have cancer, and that's what I'm doing. I'm going over the booklet for. Um, if you are a blood cancer patient, they give you a booklet, and it has different sections in it, but I'm just going over what it said about self-care. That's it. Y'all must don't know. I'm not about numbers and stuff, so I'll block you in a minute because I'm not even into like having a lot of numbers and being monetized. I'm not the type of person that'll step over other people or do whatever it takes to climb to the top. That's not me. I feel like I'm already on top. I'm a child of God. I have had him in my life for a long time. So I don't feel like I have to do much else to really be considered as on top. I feel like I have this certain feeling that I just can't shake ever since I found God for myself. So I am quick to distance myself from anything that I feel like may hinder my happiness. I'm sorry to hear that. I'm sorry to hear that your daughter is going through that. Sorry to hear that you got that diagnosis. I know years ago my godson was diagnosed with it, and it broke me. It literally broke me. They say that when you see a child going through something like that, it'll change you one or two ways. Either it'll have you going like kind of out of control, spiraling out of control, or to make you rethink life. And with me, I think it made me rethink life because I watched him fight like it was nothing. Huskers? I haven't heard of that. Let me see if they have it on here. No, it's not one of theirs, but I'll look into it because Like I said, I had the cracks in the creases of my hands, and they don't want you to get infections, so the last thing you want is any cracks or, cuts or anything. So that was a major thing for me. They also have on here about sun exposure and insect bites. So that's something that I'm gonna have to get better at when we're going in and out. They want us to wear something over our arms. They say try to wear long sleeve and pants when outdoors to avoid insect bites. I got to get better with that because when it's hot, I don't like wearing long sleeves. Also, we can't go to the nail salon. We can't go to the nail salon while we're outpatients. Reason being because a lot of places do not clean their instruments, their tools. Some people may not even clean their area, their workstation. So they urge us not to go to any nail salons or spas. Don't get any piercings. Now I'm reading this now, y'all, so I'm not just talking out the side of my neck. I'm doing good. Destiny Forever, I am doing great. I was just saying that I received some information because I am about to start the process of a bone marrow transplant, and I'm kind of nervous and I'm kind of excited at the same time because I know I don't hardly say it much, but the type of leukemia that I have is fatal. When it once it went into the blast phase, it is harder to treat than some leukemias, and I try not to say that too much, but because medicine has come a long way in the past few years, so I don't want to put that out there, but it is what it is. So I was just going over some of the things that I was told, and they wanted me to read over it. They already told me some of this, but they still wanted me to read over it. Yeah. So, but I'm doing good. I'm just a little drained, a little tired. That's why I came on to do my live a little earlier tonight because I feel like by 7 or 7:30 I'm going to be totally wiped out, especially after I take my panatinib. I I take panatinib. That is basically a chemo pill. So I know once I take that, I'm gonna be out. So I came in before 7. So what else is on here for self-care? Eating. It's a lot of stuff I can't eat unless I um, clean it myself. As far as salads, they don't want me to eat any takeout salads at all. And anybody who knows me well know I love a good Zaxby salad. I can't eat Zaxby salad. If I have a salad, I have to actually prep it myself. That way I know for sure that each item has been cleaned the way it's supposed to be cleaned, prepped, and all that good stuff. So that's a hard one because when you're going through this, you don't have the energy that you usually have, especially when your platelets or your hemoglobin is low. So the last thing you want to have to do is stand and prep uh, food. Nice to meet you. I hope you get something from it, Nova. Thank you for joining me. Um, so yeah, they tell you the different foods that you can and can't eat. What would be best for whatever situation you may be in. Like, say for instance, if you have loss of appetite, they have a list of foods that may be good to build your appetite. And they also have foods that you should not eat if you're experiencing anything like diarrhea, vomiting, some of those side effects that come with chemo. Some people have those side effects, some people don't. Um, Mouth care. They urge you to brush your teeth often. with a soft toothbrush because you don't want your gums bleeding, especially if you have low platelets. Um, Soft toothbrush, mm, floss your teeth daily. If your platelets are at a number where your doctor feels like it's um, appropriate to be flossing. Avoid alcohol-based mouthwashes. And what else? Club soda. They urge that if you can't use the mouthwash or if you don't have that on hand, the kind that doesn't have the alcohol, you can use club soda in place of that. They want you to drink plenty of fluids because that will help you avoid dry mouth. A lot of people get dry mouth doing their chemo treatment. What I noticed when I was in the hospital is that they do offer a lot of soda. And that was a little strange to me because I've been working all this time to try to cut back on sodas. And then once I was in there getting treatment, it's like they offer you soda a lot. So I had to literally like ask for water or protein shakes. The only time they really wanted me to have a soda is when I would have a really bad headache. I'm sorry, y'all. I have to I have to deal with certain people just not on topic. So, yes, if you're dealing with diarrhea, they want you to avoid things that have high fiber content, which is understandable. Understandable. Please let your nurses know if you are experiencing, even if you just started experiencing, don't wait till it get bad. If you start to feel like you may be getting a little nauseous, tell your nurse. If you feel like you may be having a little diarrhea issue, tell your nurses. Even constipation, tell your nurses because 9 times out of 10 they have ways that they can help with your side effects. Um, okay, now we get into the part where I was like, what? What? That's why I thought it would be a good idea to do a little quick video. So, physical activity. We recommend that you spend most of the day out of the bed. See, this is where your caregivers really communicating with your doctors or your team really comes into play, because your caregivers may think that it's okay for you to lay down all day because the old school is like your body needs rest, your body needs rest. But at the same time, you got to get up and move. You got to get up and move. So that was one of those things where I'm like, okay, I'm going to have to make sure everybody's on board with this. You will be encouraged to exercise. People were getting on me because I was dancing, I was walking. It does your body good the more you move. And it wasn't just me. They wanted everybody on the unit who could to try to get up and walk at least a mile a day. Sandra D. Hey, Miss JoJo. I loved your live today. You had me over here on fire, Miss JoJo. I was over here talking to the screen like, that's right, that's right. I love watching you, Miss JoJo. Um, so it does say they encourage you to walk. They encourage you to keep moving the more that you can move. And I always tell my caregivers and my doctors, if God has given me strength to go, let me go. I don't want anybody forcing me to sit if I can. If I can get up, go to the sink, brush my teeth, wash my face, that means God has given me that ability to be able to do it. Let me do it for as long as I can do it. And that's just how I feel personally. But at the same time, they don't want you to overdo it. I already mentioned they want you to walk a mile a day. around the hospital unit without leaving the unit, of course, because they don't want you to get any germs. Your immune system is compromised. Your immune system is compromised when you are on this chemo regimen. I know mine, it knocked my numbers down so low to the point where it was an issue with getting my numbers to try to come back up a little bit. So yeah, your immune system is compromised. So you cannot go off the floor. But they urge you to walk around, they urge you to move, they want you to get up out the bed and like go to the sofa. They want you to exercise your mind also. So be it reading a book, crossword puzzle, coloring, they encourage that also. They don't want you to push yourself too hard. And if you get tired, then that's when you rest. They don't want to say you have to be doing, you have to be doing. You listen to your body. Listen to your body. If you feel like, okay, now I'm out of breath, or now I feel like my heart rate is a little too high, listen to your body and sit down. You can even let your nurse know, hey, I already walked half a mile and I got a little winded. They will mark down that you did walk, but they're not going to say, well, you need to get out there and do another one. It still counts as moving around. Don't try to push yourself. And this part right here is what people ask me about all the time. Why? I don't know. But if your immune system is compromised and if your platelet counts are low, I'm just going to give the short answer because I've already read this part. Yeah, I already read this part. If your blood count is low and your immune system is compromised, do not engage. Let me see. Yes, it is. Mind exercise is very important. Yes, Sandra D, we are so happy that you are feeling better. Yes, Yam, I'm going to get a bone marrow transplant. So these are some of the things that I have to go over to make sure I am in tip-top shape to receive my donor's bone marrow. And I already have a small chance of survival. But the way I see it is, I'm not going down without a fight. I'm going to give it everything I got. And it is what it is. I'm happy with my footprints that I have here on earth. And if God wants me to stay a little bit longer, then it is. It shall be. If he wants to call me home, then hey, it is and it shall be. Um, this is kind of a mean and cruel world anyway, so I'm not. I'm fighting to stay for my babies, my family, but I'm not in a big rush to just stay here just to watch the way this world is going now. No. So, like I was stating earlier, the type of leukemia I have is considered fatal. That's the way the doctor told me, it's fatal. And the only thing that is on my side is the fact that my age, I am 44 years old, so my age is on my side. And also the fact that I was very active before I got sick. Thank you. Thank you for your prayers. Thank you for your prayers. They are, um, they don't go unnoticed. And I feel the prayers. I feel when people are praying for me, and I really appreciate it. Mm-hmm. Yeah. So, like, when the doctor first told me, he told me and my husband like a year ago how bad it was, and we didn't tell the kids that part. We just let them know that it was leukemia. Um, but he was saying that I was so far on the accelerated headed to blast phase that I may need to come see him again. He was the specialist for bone marrow transplants. And I was like joking with him. I was like, well, I don't want to come back and see you then. Because he said, we need to try our best for you not to get into the blast phase. And that's exactly what happened. I got into the blast phase. So, yeah. When it comes to activity with your partner, if your partner has cold, flu, any type of illness, do not engage. If your numbers are low, do not engage. However, if your numbers are high, however, if your numbers are good and your partner is not ill, it is safe to continue to show your partner some love. And you should always have a barrier. I'm just going to put it like that because I don't know the ages of people who are watching right now. But you should always have a barrier of protection. J3. You're not supposed to be on here. You the honey guy. And you know what? I gotta let you know. I was so upset because I'm about to get this bone marrow transplant done. And during this transplant time, I cannot have raw honey. I cannot have honey from a honeycomb. That's just during this time. But once it's all completed and the cells have what you call it, like grafted or whatever, and then after my numbers recover, then I can start back eating things like honey, like raw honey. So I can't eat that anymore right now while I prepare for this transplant. It's a lot of things I can't do. Y'all, I can't garden no more. I gotta wait until at least 6 months to a year after the transplant because they say that there are chemicals and fumes and all types of things that come up through the soil. So it's hurting me to see my garden just looking so sad and just like mama don't love me, daddy don't care. And that's one of the things that help with my mental is being out in the garden. And now that I can't do that anymore, I'm trying to find a new hobby that I can get into. And it's hard to find a new hobby, something that I feel like I can really, I don't know, get used to. Because I've done gardening for so long. Destiny Forever Walks is saying, hello, J3. So I think these are the last two, y'all. Because I am getting tired. And I am going to admit when I get tired and I start getting a little bit out of breath. But the good news is today when I went into clinic, all I needed was potassium. My red blood cell count was a little bit low, but not low enough to need a transplant. I did not need any platelets, any blood, any of that. I just needed 2 potassium pills. And if you've ever had to take a potassium pill, you know that those things are huge. But I had to take 2 potassium pills, and that was it. So tomorrow morning I have to go back. That's one thing about this. When you're diagnosed with cancer, you have a lot of appointments to keep up with. It's very important that you have people around you that love you and that want to see you beat this thing. And they are going to have no issues, no problems with making sure you get to where you have to go. Get you a circle. Get you a circle of people that love you and care about you. And hold on tight to them. Because they, along with your doctors and along with the Most High, well, whoever you serve, but I know in my case, it's the Most High Yah. And I know that with the circle that I have around me, that even if one person has something to do, I have somebody that's willing to step in and make sure I get to my appointments. It's very important that you have people around you that don't mind taking you to your appointments, because those appointments are very important. They have to access your port. They have to run your labs. That's when they see what you need, what you're lacking, what you're not lacking. And I have to go pretty much every day right now. And after the transplant, I'm going to have to go every single day for at least a month. And then after that, it'll start to wean down a little bit. So yeah, it's my port is still a little bit swollen. The area of my port is still swollen. It's right here, and they access it right under the scar. And then I have another scar here. I don't know if that's where they went in or what. I don't know what that scar is, but whatever. I'll find out. So the last two are your mental health and your spiritual health. That's what we were just talking about anyway. Um, but I kind of wanted to touch on just a little bit the fact that some things you may want to keep to yourself. I'm just being honest. Some things you may want to keep to yourself, because when I was in the hospital, I realized that um, when I mentioned that I like to watch funny things before I go to bed, someone came in there and like suggested something that wasn't so funny, and it was really demonic. All right, thank you, Destiny Forever Walks. Thank you for coming in. I enjoy you. I see you still out there jump roping and treadmilling and doing your thing. Keep going. Good night. Thank you. Yeah, so as far as your mental health, you may not want to tell everybody what makes you sad, what makes you down, or whatever. Um, just tell your circle. Tell your circle, the people who you trust, the people who you love. If you like coloring, it's okay to tell some people, but I've seen for myself that some people will come in and do the total opposite of what you said helps get your mental together. Um, I know um, a preacher's kid. It's hard to say that now, but I know that I was raised in the church and everything. But one thing that helps with my mental health is before I go into a procedure or before I know they're about to put me to sleep, it helps me to listen to rap music. That's my alarm. Let me know it's time to take my medication. But some people get upset when they find out that I like to listen to certain music when I'm trying to hype myself up. And I like listening to old school. Y'all know I love LL Cool J. I'm bad. I love listening to that right before they getting ready to take me into something, because it just boosts me up. It make me feel like I got this, I got this, I got this. So if you have somebody around you who's going through something like this, that is not the time to criticize what helps them get through it. That is not the time to criticize everything they do. They already feeling, vulnerable. They have been humbled enough. Trust me, when you're in the hospital, you are humbled because you have no privacy. People are busting in on you all day, all night. They're asking about your poop, your pee. They're even checking your stool and your pee. Sometimes they even have to be in the room with you for a long time. If you're receiving blood products, they just have to sit in the room and watch you the whole time. So that's not the time to criticize people. Thank you. Thank you. I try to listen to clean stuff because I don't like nothing that's too out there. That's why I don't do a lot of the trends that I see. I try to keep up with some of the trends, some of the dances, but I don't know if you guys have noticed or not. I don't like to do every trend because some of them just I hear the words and I be like, whoa, 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 whoa. But if I want to listen to a little old school hip hop or something to boost me up, I feel like I should be okay to do that. Let me do what I need to do to make sure I don't go crazy on the table or to make sure they can get me back there without having to give me anxiety medicine, because they have had to do that before for me. They have had to give me something to calm me down because I just kept saying I don't want to feel anything. I don't want to feel anything. So if listening to music helps your person, let them listen to their music. If them watching a comedy show helps them, let them watch their comedy show. What is it gonna do? What is it gonna do? Let them do what they need to do, just like J3 just said. Let them do what they need to do to get through your mental health. And they actually have it in here. Your mental health is very important. Don't try to please everybody around you. They actually have in here. Do not try to resume all of your previous responsibilities immediately. Do not do that, because you will drain yourself emotionally and physically. Keep your stress factors to a minimum. Keep your stress factors to a minimum. I can't stress that enough. When your friends and family offer to help you, let them help. Even if you are independent like I am, I was so used to driving myself around everywhere, doing everything I needed to do, and now I can't do that. So I have to be okay with people offering to take me where I need to go. Um, it's also saying in here that your children or your friends, your family may start to treat you a little different, but it's nothing personal. It's just that they don't know the right words right now, or they don't know how to come at you. So, if you know anybody that's going through any type of illness or chronic illness, where they're going back and forth to the doctor, or they're going through all the testing and all of that, sometimes it's okay just to just be there, just to let them know that you're there if they need you. You don't have to try to put on a fake persona or make up something in your head to say or whatever. Just letting them know that you're there is good enough. And your children, it has in here that they'll come around. The thing is, their schedule has probably been changed because their parent, who was always there, is now, kind of in and out, not there as much as usual. Or if you had to stay like I did for over a month in the bone marrow unit, my babies, when I came back, they saw my head for the first time and they didn't want to hug mama. They didn't want to come near me. So eventually they started hugging my leg, which was good because I'm not even supposed to be like in their face like that right now. I had on my mask and I wanted them to at least hug my leg or something, and they saw my head and they was like, no. um Last but not least, because I'm finna lay it down, y'all. I'm tired. I'll talk about the food stuff another time. I don't like promising lives because I get out of breath and I get tired easily. But I will try my best to do as many videos and try to spread awareness as much as I can when I have the energy to do so. I'm not a big numbers girl. I'm not on here trying to beat nobody or do a rat race or nothing like that. I'm just doing me. If people like it, they'll come. If not, then it is what it is. Um, so last but not least, the spiritual care for self care for leukemia patients, inpatient or outpatient. Having a spiritual connection will reduce anxiety, stress, depression, and discomfort. Whatever you connected to, you better make sure you connected. You better stay prayed up, or whatever you do. Me personally, I like to stay prayed up, and I like to kind of read the word just to kind of remind me here and there what thus saith the Lord. Sometimes I have to remind him what his promise was to me. And that helps me get through. Thank you. Thank you for coming by, Dietary. Thank you. Um, it stimulates self awareness and personal growth. It promotes a more positive outlook, and it promotes a sense of inner peace. So your spiritual care is very important, because if you, it's almost like a I don't even know what to call it, but it's like when one thing goes, the other thing goes, like an effect, like a butterfly effect. It seems like to me, once you have your spirituality and your mental in check, other things fall into place. If your spiritual is right and your mental is right, then you won't have any problem with getting up and trying to care for yourself. You'll feel like, okay, I got this. You can encourage yourself. Um, you'll feel the strength. If you have faith, you already just know. People ask me how you jump around dancing and smiling and stuff. I think it's just my faith. I have come to I have come to a point in my life where I just kind of roll with the punches now. And going through this really made me, it pushed me into another frame of mind. I'll say that. It pushed me into another frame of mind because I used to worry a lot, a lot. I still worry from time to time, but I used to worry a lot. And if you look at some of my old videos, I would say, like, I wish I had the mentality of whatever. I wish I had that mentality. Back then I was actually asking for that. And now with me going through this, I have developed that mentality of, well, whatever. It's not bothering me. It's not affecting me. I'm concentrating on my health right now. It is what it is. Whatever. So I have adopted that mentality now. I asked God for it maybe 3 years ago. And I didn't know it would take me going through something like this to actually get to that point. But now, when people do stuff, I might get upset for a moment. Then I have to think about it like, this ain't going to help me. This is not going to help me. Thank you. I'm going to stay strong, and I am going to keep on pushing. I'm not going down without a fight. Put it like that. Oh, yes. When we remind him of his promise. Yes, my grandmama used to say that all the time. Remind him of what he promised you. Promise he'll never leave you nor forsake you. And a lot of things that she used to tell me, I never thought in a million years that I would be going back to that now. But I am. But I am. So, with that being said, y'all, I don't know how it got mixed up. I know when I was watching Boss Lady Denise this morning, she was saying, I thought you was going to be doing a live every day. I said I was going to be posting something every day, y'all. I can't do a live every day. My life is too busy, and sometimes things are going on where I just can't pick up my phone right then and try to record and all that. Like I said, I'm not a numbers girl. I got out of one rat race, and I'm not trying to get into another one. I'm not trying to beat the clock or whatever to climb to the top, and I'm not trying to push anybody down to get up. I just put it out there. If anybody wants to listen, then they'll listen. If not, then they won't. I just ask that God be in everything that I do. Yes, I know Miss JoJo. Miss JoJo, you know that word. That's why I told you earlier today you had me on fire over here. But yes, I put it out there, and I try to put God in everything I do. Everything. Even before I go into that clinic, I might laugh and I might joke around. I might be the silly one in the family. I might be the one that like to play or whatever. And I can't never get my words out right. But God knows in my heart that before I do anything, I'm always saying, God, let it be you. Not me. Let it be you that they see. And that's it. And like everybody do say, that's all I have, ain't got no more. Because once you do that, once you say that, it is what it is. It is what it is. Sometimes I have to remind myself to pull myself back and let whatever the Holy Spirit is trying to get out, let that come out. And that's what I go by now. But I'm glad y'all joined me. I hope y'all click the thumbs up. I hope y'all enjoyed this live. I will try my best to post something every day, even if it's just a quick short. But this is September. This is Blood Cancer Awareness Month. And like I always tell y'all, if y'all feel a little bit off, if you feel tired for no reason, if you're bruising for no reason, um, if you're bleeding, be it from the nose, the mouth, the ear, for no reason and there's no explanation for it, go see a doctor. If that doctor does not take you seriously, you go to another doctor and you get a full blood panel. Don't let them just check your iron. Don't let them just check your vitamin D. Request a full blood panel. And with that being said, I'm tired, y'all. Gracias por ver. Thanks for watching. Adios. Bye. Thank y'all for joining me. Bye.